The social determinants of health are the circumstances in which people are born, grow up, live, work, and age, and the systems put in place to deal with illness. These circumstances are in turn shaped by a wider set of forces: economic, social policies, and politics. The global context affects how societies prosper through its impact on international relations and domestic norms and policies.
These in turn shape the way society, both at a national and local level, organizes its affairs, giving rise to forms of social position and hierarchy, whereby populations are organized according to income, education, occupation, gender, race and ethnicity, and other factors. Where people are in the social hierarchy affects the conditions in which they grow, learn, live, work, and age, their vulnerability to ill health, and the consequences of ill health.
In this seminar, we will address inequities in countries, between countries, social gradients, cultures in Canada, such as Aboriginals and new immigrants, as well as the prevalence of mental illness, with a focus on the Code-Red study in Hamilton. Health inequities are avoidable inequalities in health between groups of people within countries and between countries. These inequities arise from inequalities within groups and between societies. Social and economic conditions and their effects on people's lives determine their risk of illness and the actions taken to prevent them from becoming ill or treat illness when it occurs. Some examples of health inequalities between countries: the infant mortality rate, the risk of a baby dying between birth and 1 year of age, is 2 per 1,000 live births in Iceland. However, it is over 120 per 1,000 live births in Mozambique. The lifetime risk of maternal death during or shortly after pregnancy is only 1 in 17,000 in Sweden. However, it is 1 in 8 in Afghanistan. Examples of health inequalities within countries. In Bolivia, babies born to women with no education have an infant mortality greater than 100 per 1,000 live births, while the infant mortality rate of babies born to mothers with at least secondary education is under 40 per 1,000. The prevalence of long-term disabilities among European men aged 80 plus years is 58.8% among the lower educated versus 40.2% among the higher educated.
What is meant by social gradient? The poorest of the poor around the world have the worst health. Within countries, the evidence shows that in general, the lower an individual's socioeconomic position, the worse their health. There is a social gradient in health that runs from top to bottom of the socioeconomic spectrum. This is a global phenomenon seen in low, middle, and high-income countries. The social gradient in health means that health inequities affect everyone. For example, if you look at under 5 mortality rates by levels of household wealth, you see that within countries, the relation between socioeconomic level and health is graded. The poorest have the highest under 5 mortality rates, and people in the second highest quintile of household wealth have higher mortality in their offspring than those in the highest quintile.
International flows of aid, grossly inadequate in themselves and well below the levels promised, are dwarfed by the scale of many poor countries' debt repayment obligations. The result is that, in many cases, there is a net financial outflow from poor countries to richer countries, an alarming state of affairs. The trend over the last 15 years has been the poorest quintile of the population in many countries to have a declining share in national consumption. In Kenya, for example, at current economic growth rates and with the present levels of income equality, the median family of poverty would not cross the poverty line until 2030. Doubling the share of income growth enjoyed by Kenya's poor would mean that the reduction in poverty would happen by 2013.
Gender biases in power, resources, entitlements, norms, and values, and the way in which organizations are structured and programs are run damage the health of millions of girls and women. The position of women in society is also associated with child health and survival of boys and girls. Health equity depends vitally on the empowerment of individuals to challenge and change the unfair and steeply graded distribution of social resources to which everyone has equal claims and rights. Inequity in power interacts across 4 main dimensions: political, economic, social, and cultural, together consisting of a continuum along which other groups are, to varying degrees, excluded or included.
Moving on now to the anthropological study of social determinants of health, specifically the study of Native and Aboriginal cultures in Canada. It is known that many Aboriginal cultures in Canada face issues which affect their life expectancy. The average life expectancy of an average Ontarian is 70 to 73 years old, whereas an Aboriginal person living in the same region would be expected to live 68 to 70 years. These issues can be attributed to a few factors: lower education levels, higher poverty levels, and limited access to health care due to their remote locations, poor food and nutrition available, often due to their remote locations, health screenings are not done for things such as cancer and diabetes due to lack of knowledge and information available. Other conditions include low birth weight, which affects children, also conditions such as ADHD, fetal alcohol syndrome, and undiagnosed mental and physical illnesses. Teen pregnancy is also extremely high in these cultures, which causes a whole host of other health issues. Some of the prevalent illnesses and conditions include diabetes, cancer, high blood pressure, high cholesterol, heart disease, and suicide. Suicide rates are a leading cause of death, 11% higher than the national average. Using Aboriginal culture as a case study for the Anthropological Social Determinants of Health, we are able to highlight the inequities in cultures, such as access to healthcare, poverty, and illness.
On top of the social and cultural perspectives of the effects of social determinants of health, when it comes to mental health, 3 social determinants are particularly significant: freedom from discrimination and violence, social inclusion, and access to economic resources. Different communities or populations have different experiences with the social determinants of mental health. The impact of these differences can be health inequities, entire communities with poorer health or mental health than the general population. Numerous Hamilton studies, including the Social Planning and Research Council (SPRC) report on poverty in 2004, the City of Hamilton Social Index, and the Spectator's Code Red articles have identified particularly disadvantaged areas of Hamilton. These have the highest rates of psychiatric-related emergencies, 88 per 1,000 compared to 2.6 per 1,000, and the highest rates of trauma incidents to children under the age of 16, 264 per 1,000 versus 33 per 1,000. The SPRC's Poverty Profiles report in 2012 shows us that in the riding of Hamilton Center, 42% of the children were living in poverty, and the Rich and the Rest of Us report in 2013 stated that there was a lower city postal code area with 46% living in poverty. This information shows us that there is a great divide, even in our own city, when it comes to mental health, which corresponds to socioeconomic status. The areas of the city with the poorest mental health are also the areas of the city with lowest median household income. Further, ideologies on health greatly differ in these areas. Generally, those in the Code Red area of Hamilton may shrug off symptoms, not visit a doctor regularly, or may not even have the time to focus on their health due to the fact that they may be working multiple jobs. In areas of the city where the residents are of an upper middle to upper class, they may emphasize healthcare as a priority by ensuring that their meals are nutritious and organic, that they visit a doctor regularly, and treat a mental or physical illness that arises in themselves or their family quickly. This may also be due to the fact that these people can afford the time and money to focus on their health. As you can see, even in the Hamilton-Wentworth District School Board, there have been a few solutions to this problem. On October the 20th, 2014, which is very recent, there were 2 motions put forward by trustees to address this issue, focusing on the Code Red areas of Hamilton. Both motions are attached herewith.
Here's an example of a scenario that focuses on the social determinants of health through the lenses of sociology, anthropology, and psychology. You are entering the last exam season of your undergraduate career. As usual, you have the worst exam schedule. You ask your manager at work if you can take 3 weeks off because you are desperately in need of study time. But, just like all of the other times you've asked, your manager says no and you feel taken advantage of. You hate where you work and you consider quitting, but quickly put that thought to rest because of rent and OSAP. They won't pay themselves. Your life has fallen to a dull routine of school, work, and you feel hopeless.
A sociologist would look at the situation and say that this student is obviously of a lower socioeconomic status and is struggling to support themselves. This in turn would not make health a priority but a distant thought, as their main concerns are regarding school and sustaining themselves. As a result, they will not focus on nutrition, seeing a doctor because they do not have any free time in their schedule, and may not realize any health concerns developing.
An anthropologist would look at the situation and say that university culture which you live in normalizes a stressful living environment. This in turn would create norms which are detrimental towards your health. It makes it seem like neglecting your health and well-being is typical, and as a result, this would not only create mental and physical health problems, but also morph ideologies of healthcare.
A psychologist would look at the situation and say that they are struggling to prioritize important aspects of their life, including things like health and money. They are struggling to not only find themselves in their place, but to also adapt to this newfound independence. Gone unchecked, this could lead to depression, anxiety, and other health issues.